My name is David Lopez. I'm a technical assistance training specialist with the Center for Applied Research Solutions. With us today, I have my colleague Danielle and Andrew. Our Miranda March, our project director, I do not believe is on this one. But if you just want to say hi, please do. I see Danielle smiling.
Sorry, I was struggling with the mute. Hi, everyone. It's great to be here with you all this morning. Really looking forward to connecting with you all individually as well, and working with you as we work towards the June 30th, 2024 date. Please feel free to contact me or email me if you have any questions or anything. You can direct message me as well. And we're here to help. Looking forward to working with you all.
Yeah, good morning, everyone. I'm Andrew Haw, he, him pronouns, and I'm the project manager for the MTech teams. And yeah, likewise, just echoing what Danielle said, excited to be working with you all and working towards the implementation of this new benefit.
Awesome. Thank you, guys. And with us, additionally, one of our partners is Kaufman and Associates. With us today, we're welcome Josh Severance, who's a tribal behavioral health and SUD advisor. Me and Josh have worked together on this project for a while now. And Josh, if you'd please introduce yourself to the community.
Bonjour, Dino Magnado Ganin, Yakiznia Kichiden Dijnakash, Miska Makwa and Dodo. So what I said there is hello, my relatives. Good morning. My name is Joshua Severance. I shared my Indian name. Is a Dakota name that means the warrior who heals. I'm an enrolled member of the Little Shell, Anishinaabe. I'm also a descendant of the Yinkin Dakota and the Fort Belknap Union from Montana. I currently reside on the land of the Sietch-Uamschup here in northern Idaho. And I serve as a behavioral health SUD SME for Kaufman and Associates, and really happy to be here and I've enjoyed the last several months with partners at CARS, and really looking forward to connecting with everybody. I'm here to support with tribe and tribal engagement, and then also wherever I'm helpful. So thanks for sharing this space with me this morning. Good morning, everybody.
Thank you, Josh. Okay. Oh, a little too faster with this scroll. All right. So here's what we're hoping to cover today, or here's what we will cover today during this session. So what we're going to do is provide a mobile crisis benefit overview for that new mobile crisis services that's being offered. We're going to go over the website, which is and how you can navigate that website. It's going to be really that webpage, and this website is where you'll be able to locate a lot of these resources, the trainings, how to get them, how to do your implementation plans. So we'll do an overview of that. We're going to go over the trainings, the required trainings and the enhanced trainings, just kind of show you where they're located. We're going to instruct you on how to receive certificates of completion, and that's something that's very imperative for the implementation plan that you all do these trainings. We're going to show you where the standardized tools are located. We're going to go over a brief, just the FAQ of the DHCS Medi-Cal Mobile Crisis Benefit. And we're going to show you how to request TA. And then we're going to talk about upcoming questions. And when we get started, just to start us off with the general question, if we're going to have one poll coming up right now, and if you would please respond. Okay, and the question is, how ready is your county to implement the benefit by June 2024 on a scale of 1 to 5, 5 being the most ready? So we have 1 at a 1, 2 at 3, 1 at 4. All right. Give it one more second for it to close down. Six of 11. Okay. I know we have some people that just joined in. If you could please put your name and organization in the chat box. And it looks like we have 6 of 11 with us. That have responded. So We have 2 feeling that they're out of 4, 3 feeling that they're out of, I'm sorry, 2 feeling that they're out of 3, 1 feeling that they're out of 2, and 1 out of 1. So, all right, well, we're getting a general feeling of how we're feeling for this, and that's all right. We're going to help walk each other through it and help guide you and support you along the way of this. So, thank you for participating in that. So what we'd like to do right now is move into what the Medi-Cal Mobile Crisis Services are, and give you an overview of what the BIN, Behavioral Health Information Notice 23-025 is.
Sorry, David, I think there's a few more poll questions.
Oh, is there right now?
Yes. So we'll go ahead and launch the poll questions and get through those and then jump back into the PowerPoint.
Okay, well, go ahead and launch those. Thanks for the help, y'all.
The next question is just asking if your county intends to use the DHCS developed standardized tools. If you're not aware, the benefit does require for there to be 3 standardized tools, so dispatch, crisis assessment, and safety planning. You counties can elect to use their own tools. They just must be approved by DHCS prior, or you can use the already developed standardized tools by DHCS. And one thing to know about the tools is you can add to them. The DHCS tools you can add questions and add your own content to them. You just can't take anything out of them. So just some information. So we have 6 out of 11 of you answering. If we can get a few more responses, that'd be great. Quite a bit of you are unsure. All right, we'll go ahead and move on to the next poll question. Thank you. And the last question, second to last question, sorry. How do you feel about your current relationships with Native tribes in your county? You can just put a few sentences to describe current relationships, and we'll go from there. Thank you. All right, I think we'll go ahead for the sake of time. We'll go ahead and move on to the last question. And if you didn't get to finish putting your answer in, feel free to drop it in the chat, or you can directly message myself, David, or Andrew Ha, and we will note that for you. Tell us what your county is struggling with or doing well with preparation for this benefit. Again, just take a couple sentences and let us know what's going on in regards to your preparation for the implementation of this benefit. And this is the last question, and then we'll jump into the fun stuff. All right. And again, for the sake of time, we're just going to go ahead and end the polling. And again, the questions are in the chat box. If you didn't get a chance to enter your responses in the poll, feel free to put them in a chat or send them to us directly. We definitely want to hear from you because that is the best way we are able to show up and support you. Thank you all for taking a few minutes to answer these questions.
All right. So now that we've shared and put down some of those responses, we're going to go ahead and go over what the Medi-Cal Mobile Crisis Services, the Behavioral Health Information Notice is, and what the intention of this new benefit is, and really helping to set the stage for how this mobile crisis service should be provided to those in the community. So with that, the Mobile Crisis Services provide, and this is coming from BIN, Behavioral Health Information Notice 23-025. Mobile Crisis Services provide rapid response, individual assessment, and community-based stabilization to medical beneficiaries who are experiencing a behavioral health crisis. Mobile Crisis Services are designed to provide relief to the beneficiaries experiencing a behavioral health crisis with de-escalation and stabilization techniques that reduce the immediate risk of danger, subsequent harm, and avoid unnecessary emergency department care, psychiatric inpatient hospitalizations, and definitely reduce that law enforcement involvement. Again, this comes from the Behavioral Health Information Notice 23-025, which can be located on our website, which we'll show you in a second. So what does this really mean? So the benefit is really trying to drive a new direction for mobile crisis services to change it from like an assessment heavy type of interaction to really providing that resolution focused trauma informed care when this mobile crisis teams goes out to meet the individual and really working toward providing relief and alleviating some of that psychological stress and pain that they may be going through at the time and supporting people in crisis where they are. And a big goal is really that we want to use the most least restrictive means necessary for the individual. So with limited resources and understanding that it's hard to get to people, there may be a lag or a delay in getting some treatment. We have a shortage of treatment providers across the state. This mobile crisis benefit is engaging the individual where they're at and helping to help provide that immediate relief in the field so they can experience that resolution in real time. Previously, some of the other mobile crisis teams and units throughout the state had a heavy focus, or their lens was really on assessment. So in that assessment piece was when they were called out, they were really looking at does this individual meet criteria for to be placed on an involuntary hold or not. And here we're shifting away from that. And that wasn't everyone. Some of the teams that like myself and Danielle had worked on before were in the spirit of this and providing that resolution focus. But here with this benefit, we're really trying to provide that bridge and that support in real time to them. So the new direction for mobile crisis services should be person-centered. We definitely want to treat the individual as the expert in the life that they are and respect where they're coming from. We want to be trauma-informed in the responses and how we actually help them through this intervention. We want to be equity-driven. We want to provide a brief intervention that is focused on providing some sort of resolution and de-escalating their current heightened state. We want to work from a lens of least restrictive interventions. We always want to be culturally appropriate and accessible to the individuals with that individual. So now what we're going to go over is the Medi-Cal Mobile Crisis, the TA Center website. That can be found at camobilecrisis.org. What we're going to do, or what I'm going to walk us through, is an overview and navigation of the website. Then we'll show you where the implementation plans are, show you where the trainings are, and then we're going to speak to or how to request technical assistance. So let me just bear with me 1 second as I prep this up and shift between screens. 1 sec. All right, thank you. So this is the website that we have, and it's at camobilecrisis.org. And this is the hub of where all kinds of great information is located at. If someone would please drop the website on the chat so they can have it, or the link to the website on the chat, that'd be great. And let me go ahead and just kind of go over what it is. So this website is really houses a great deal of information for us. Up front, up top, you can see it's going to show you where the archive trainings are. It's going to give you a link to the implementation plan. It's going to go over the standardized tools. It'll also show you how to request TA and a way to contact us. So let me move this out the way real quick. So the first thing I really want to show you is this required core trainings and required enhanced trainings and recommended supplemental trainings. When you click on the required core trainings here, it'll take you to a list of all the different archive required trainings. This right here is going to show you each of the trainings and how to access it. The crisis assessment training, the trauma-informed care training, harm reduction strategies, and collaborative culturally responsive crisis safety planning, introduction to culturally responsive crisis care in diverse communities, co-occurring disorders and responding to substance use disorder crises, introduction to culturally responsive crisis care for tribal and urban Indian people, crisis intervention and de-escalation strategies, crisis response strategies for adult individuals with intellectual and or developmental disabilities, crisis response strategies for children, youth, families, including intellectual or developmental disabilities. So this list right here is the required trainings there. Upon completion, and this, each one that you would go to, you can just go down and launch it here. And then you can access the training by selecting play on this one. Or you can watch, there's some pre-recorded versions of this training. And then you can also view the training slides. Below each one of these, when you do this, it gives you an overview of what the training is and the length of the trainings. Now, again, some of these are these are the required trainings and are what you will need to complete in order to be able to implement this for the mobile crisis benefit. Okay, so then we have the archived recommended supplemental trainings. And if you click on this link here, we have a list of a bunch of additional trainings that are there for you. And in total, I believe we have, Danielle, correct me if I'm wrong, 29 trainings in total.
Yes, a total of 29 trainings. However, only 10 of them are required for counties to actually implement the benefit. I did put a link in the chat just now to a training courses overview that was released by DHCS. It has the 5 required core trainings and the 5 required enhanced trainings. So a total of 10 required trainings. Those trainings must be completed by current mobile crisis team members or providers in order to actually implement the benefit. And we'll go a little more into that when we get to the overview of the implementation plan template.
Thanks, Danielle. And thank you for putting that in the chat. I really appreciate that. So again, here's how you can locate or navigate these types of trainings as well. And I'm going to scroll down here. So again, transforming the crisis care experience in California, consultation and supervision, and what that can look like. Community partnership coordination strategies, mobile crisis team composition, and so on. So they're located here in that archive recommended supplemental trainings. Again, the 10 required trainings that are there, and then a lot of additional trainings to help support yourself and the mobile crisis team members to be better prepared for actually providing this type of service. And then, so that's the training piece. The next thing I think we should go over is the implementation plan. So the implementation plan tab right here is this section, and you can download the IP template and instructions on how to fill it out. We're going to spend some time on that right here. So if you select this, it'll go pop up. It's kind of lagging on my side. Apologizes for that. So this is the implementation plan that you all will be completing to help assess that your ability to do it. And we're going to walk through the different components here. And then, of course, we can provide different TA throughout this. So the implementation plan, it starts off with entering your name of the county behavioral health system, the proposed launch date. Here, you're going to provide your contact information, whoever's going to be the primary contact for your county. The delivery system, the provider types that you plan on going over, and we're going to go over the provider types in a second. The mental health plan, and then we're going to go over the required trainings right here. So the required trainings, this has been updated. So if you saw the previous implementation plan by any chance, these have been updated to be a little more streamlined so we can clearly see who's completed the trainings and who hasn't. So on this drop down here, it's like crisis assessment. Choose like they have completed or completed on. And then the next drop down is just the date that it is completed. And this is speaking to the team members that have went through the training and will be providing that mobile crisis service. And this goes on for all the required core trainings, just to make sure that you do the crisis assessment and attesting to that you've done the required training, such as trauma-informed care. And this parries down the whole way, whether it's been completed, have not completed, or will be completed by. And as you develop the implementation plan and start to work on it, feel free to request some of these TA services with us, and we can help walk you through what some of these sections are, aside from this trainings itself, or what the spirit is of this. So this goes down for all the required training sections there.
And can I just add to that, David? So
Yeah.
when we're asking about the trainings, it's your current mobile crisis team members. So if they have collectively completed the trainings, and so it's not necessarily one person and you put that one person and the date that that one person completed it. It's the collective team and the as of date. So let's say crisis assessment has been completed by the entire mobile crisis team and it was completed as of yesterday. So you would choose completed, and then the date you would choose was as of yesterday. And so just to kind of give a little more background, that it is the collective of your team. And then if it hasn't been completed, then you want to identify a date of when you're anticipating the trainings will be completed by. That's really important. So it's just giving us more information of where you're kind of at with the trainings, whether they've been completed or not, but also giving us an idea of a time frame. Thanks, David.
Oh, thank you, Danielle. Appreciate that. Okay, and scrolling down. So then here, some of the biggest things that we've had is regarding around dispatch. If people are standing up for 24/7 services. So does your county, and the selection here is if you do or do not provide 24/7, 365 mobile crisis services at the location where the member is experiencing behavioral health crises. If the county offers this at the location is experiencing, does it include a 2-member team without law enforcement? So here we want to get really clear as this new mobile crisis benefit. Some of these requirements are that they're going to have a 2-member team. That it could be, and we're going to go over the list of providers, but let's say it's a peer support specialist and maybe a clinician. So a peer support and a clinician go out without law enforcement. So this is going to be the requirement for the benefit as far as the team composition itself. Of course, there's some additional safety concerns that we'll talk about in a bit that really engage when maybe law enforcement is calling you out, or for the security and safety of the scene that law enforcement is still required. But the core component of the team should be a response that does not include law enforcement. So that's what this question is really asking here. As part of this, the dispatch policy and procedures, every county must have a front-facing mobile crisis service number that is front-facing to the public. And what we say front-facing to the public is that this is a standalone number that would be marketed and promoted to the community that you serve, that they would be able to access or call for the mobile crisis response services in real time. So that would be what you would input here. It's if you have a number, or what number that you have designated for that. And then if your county does provide this service, live responses 24/7, 365. And if not, what are you doing to be able to meet that by the time you are able to implement this plan? For dispatch policies and procedures, and so you fill this out, it's going to be how you and your county will be able to dispatch the county. How are you triaging that call? And this really lines up with some of the standardized tools that we have that have been developed by DHCS and our teams throughout this whole project. And they help you triage and identify what the level of safety is for that individual, how to be able to engage with that individual in real time. So the mobile crisis tools here, so you would outline your policies and procedures, and the mobile crisis tools that we'll go over in a bit on how to access the standardized tools. So just a note, and Danielle had mentioned it earlier when we were talking about the standardized tools. There's 3 standardized tools that DHCS has provided for all the counties. One is the dispatch tool, the second is the crisis assessment tool, and the third is the safety plan tool. So once you review the tools, you can choose to use that as part of your mobile crisis service, or you could develop your own. And as Danielle mentioned, it would just be that you can add to the components that are there. It's just that you can't really take away from what's there. So here another drop down would be, if you choose, if your county does intend to use the mobile crisis to the DHCS standardized tools, or does not. And if you do not, and you're developing your own, or you have your own system in place, you would have to submit those along with your implementation plan to that. So that's what we're asking here about the mobile crisis tools. So it goes down. First is the dispatch tool. The second is the standardized crisis assessment tool. And the third is the standardized crisis planning template. So again, each one of these sections, would you be going through, asking if it does or does not, if you are or not intending to do it. Then we go through the section of promotion and engagement of local resources. How would your community engage with this new mobile crisis benefit? So what are you going on throughout here? So it asks, how will you engage with potential consumers? How are you going to engage with families or people with lived experience for mobile crisis? And how are you going to engage with stakeholders such as clinician, peers, other communities of practice on how to assess or how to roll out and develop this type of plan? And this information here, you're going to go through each, and then you're going to click below to provide that response. Then we see here, how does the county have or does not have a formal partnership with law enforcement in place? And if so, if you would please describe what the county's current law enforcement's current engagement is with mobile crisis response system. And if you have any partnerships with them, same thing for emergency services, local emergency medical services, EMS, if you have a formal partnership with them or not. And then you're going to go through it. I'm going to take a moment. So I'm seeing a few questions here. For the policy and procedures, will county be required by DHCS to have an internal policy and procedure in place? I'm assuming I would ask for what policies and procedures. Talking about the policies and procedures for dispatch, you would have to develop that plan yourself and notate or provide in each one of those sections that we went over a synopsis of what that policy or procedure is for dispatch, what that policy is for how mobile crisis teams will respond, and what some of those requirements are. And then DHCS may, or their Office of Oversight may at some point ask to see those. We're just asking for a synopsis to get a clear understanding of what your policy and procedure would be, and that we can grade your implementation plan. The second question that I see so far is, when DHCS is asking for a formal partnership, are they asking about an MOU? So yes, they're asking if you have any MOUs in place with some of these agencies, and if there is, or what's the current working relationship that you may have. For example, in past, we have had, in these past few months, we've learned a lot of different counties had strong, long-term relationships with some of their emergency service providers, such as law enforcement or EMS. And at the same time that they may not have had a formal MOU in place. So if you've had a strong working relationship, you would detail what that is or notate that there. And eventually what they're looking at as far as the best practice, if you could get an MOU in place. Now, also understanding that MOUs take time. It's not something that you that can come to agreement really quickly for the most part. There's a lot of legal issues. So it may take a little bit more time. But so it was just asking to enter that response in each one of these sections here. I hope those answers both those questions. I'm going to take a moment to pause in the chat. Am I seeing anything here? I'm seeing Danielle answering. Oh, okay.
I just wanted to also add, and for like formal partnerships with EMS or law enforcement, you don't necessarily have to have the MOU in place when you submit your implementation plan, but there should be detailed information as to what your efforts are to establish that partnership with your local law enforcement agency or your local EMS. And you should be able to kind of articulate in your plan what would have been the steps to get that going, what's the timeline to have that formal partnership, things like that. And so some counties may not have it fully developed. It is a process, but at least an effort to have got that process started and to tell us where you're at.
Thanks, Danielle. So yeah, thank you for that. It really helps out. And again, so that what helps clarify that piece, again, just to what it is and how you would be able to potentially get it. So a little bit different here. So transportation policies and procedures. So part of the benefit and being the most least invasive way to help someone who's in crisis is that how would the county potentially transport an individual who may have been in crisis to maybe a crisis stabilization center, maybe getting to a different type of space, things of that nature. Okay. Oh, sorry. So we're just making sure that we're going through everything here. Culture responsive and accessibility services. Again, here, how will the county ensure that the services care the county are culturally responsive and accessible? Notating your information here. Different type of language accommodations, going through that. How will the county use like language line or interpretation services? It goes into responding to the needs of children and youth with FERS, strategies for responding to youth and children, and then taking a moment to identify and articulate how you would provide that. Engagement with 911 and 988 type of centers. If you have any types of engagement at the time, you would enter your response. How does your team coordinate with 988 or 911? Outreach to Medi-Cal community members. And then we're going over another big section. And then you just kind of fill that out. So that's a brief overview of it. Of course, we can go more over in detail during a TA call or help you with it, but just wanted to show you where that was located at. And then I'm going to stop sharing and go back to the slideshow right here. Now we're back on our website here, and I just want to go over briefly where the standardized tools are located. So you click the standardized tools tab. And right here, you can see the DHCS tools are located under each one of these. So the crisis assessment tool, the dispatch and triage tool, and the safety planning tool. And also you have a link here to the behavioral health information notice 23-025 that you're required for. So all tool links are here. You can scroll down, get it, download it. And then there's also a companion prompt guide for these tools to help guide mobile crisis units in real time to use the tool. So the tools are standard, and we know that tools as themselves are only as good as a practitioner. And we really want to feel when we're doing like crisis assessments or dispatch that you're having a type of conversation, not an interrogation. And so that's what those prompt guides are there for, is to help the mobile crisis team members to be able to engage and use the tools in a conversational style of manner that isn't just very structured type of interview. So that's where this is located at here. The next section here is how to request TA. And so again, on the website, if you would like to create a request technical assistance, you would put your name, your phone number, your email, your role title here, your organization or agency, the county that you're from, what type of request you would like or how you would do it, some details about it, what kind of support you think would be useful, the type of activity, the outcomes you're looking for, when you would like to hope receive the help, end date, and then what populations it may be. You submit that on the website. It comes directly to us, and then myself and some of the other TA like specialists like Josh or Danielle will schedule a call with you all to help provide that individualized TA for you and get that set up for you. So that's how that's how you request TA right there. So we've already went over that right there, and how to obtain certificates of completion. You type this, you would email mobilecrisisinfo@cars.org/rp.org with this is going back to the trainings. So once you do the trainings and you complete them and the required ones, you can email this email right here with the subject line certificate of completion for whatever trainings you have completed. You'll receive a link to a form to fill out the request, a certificate of completion. To receive multiple requests, please submit multiple copies of the form. Please save that link, and this PowerPoint and links will be provided to you. For any future requests, our team will continue to update the form and include additional trainings and topics that are made. And then please allow up to 5 business days for us to complete your request. So that's how to, once you know how to navigate to the page, you go to our website. Trainings are there. Once they're completed, you email mobilecrisisinfo@cars/rp.org, and we'll be able to get that to you. Are certificates of completion required? Great question. Or can counties use their own method to keep track of trainings? This is a way so you can archive it. It is imperative that you show that you have this type of information or that you have completed the trainings. If you choose not to use these types of trainings, you would have to submit like a synopsis of what trainings you're saying that meet the requirements of that, and then keep track of it that way, and then for DHCS approval.
And just to add to that, so you can actually take the trainings from the MTAC website and put them on your own learning management systems. We have several counties that have gone through that went through the first round of implementation that did that. So they took all of the 10 required trainings and put them on their own learning management systems. That way they were able to monitor and track and also produce their own certificates of completion for their teams. You are required to keep record for monitoring compliance for the trainings. We're not going to ask for certificates for proof of certificates when you submit your implementation plan. However, if the state comes out to monitor and audit, then they may ask at that time for records. And so that is on the responsibility of the county to do so, but you are able to take the trainings and put them on your own learning management system.
Thanks, Danielle. And yeah, as she mentioned right now, again, it's just asking, we're asking in the implementation plan if the team members have been, if the trainings have been completed by the team members who are doing the benefit, but it is incumbent upon the county to maintain those types of records. Okay, so implementation plan, we went over that brief overview already. Standardized tools. I just want to give you an overview of the development of standardized tools, the crisis assessment, dispatch and triage, and safety planning. There was several drafts and revisions of this that were provided by the MTAC team along with DHCS. They were sent out across the state for both comment and review. They went through several revisions and feedback from CBHDA, counties, mental health professionals prior to DHCS final approval, and DHCS did weigh in along with their own medical expert team and behavioral health expert team, and they were finally approved. And those standardized tools are located on the website, and we can review that, or you all can take some time to review that. So the implementation dates, some key notes. Implementation plans are due for these counties on 4/30/2024. We welcome you to submit prior to that date. And so the earlier you can start working on it and getting this, we can help provide that TA, or we can work with you individually to get that set up. MTAC will continue to communicate with each county for additional information if needed once that has been submitted. And again, we can provide TA throughout this process to help you get ready to implement. DHCS, well, once the implementation plans are submitted, our internal team reviews the plans, provides any additional feedback back and forth with the counties itself. And then we send over for DHCS, who actually provide the final approval of the implementation plans. So at the time, there's 2 passes right now. It's pass or conditional pass. Eventually, everyone needs to get to a pass. And what that difference is, the difference is, like, let's say you got a conditional pass. It means that your implementation that you submitted on 4/30, saying that you're ready to go live in a few months, has all of those components. You could potentially get a conditional pass. And then it would say like let's say you have everything in place, the team members will complete the trainings, or they're in the process of completing the trainings, and you're in the process of getting the 24/7 piece up and running. So that may meet conditional pass. Then, and once you have everything implemented and all systems are go, then you would get that actual full pass. So DHCS actually sends out that in notifications to the county and make sure that informing you that you are ready to implement this new mobile crisis benefit. Again, and what is technical assistance, or what is provided? So we provide strategies on how to implement the mobile crisis benefit. We can review your implementation plan. Some additional topics that came up is like maybe potential staffing patterns, or give you some recommendations. We can support discussions of building relationships with tribes and county governments and key stakeholders. And really, myself, Danielle, and Josh have worked in the behavioral health systems and crisis systems for a very long time. There's a wealth of expertise here that you can leverage to help gather some, either brainstorm or get some additional ideas, or maybe get some just some critical thinking around how you can implement this. So we're here to help. Again, for support or individualized TA, please feel free to submit that TA request to the MTAC team that I showed you all below, and we'll reach out to you and get something scheduled. There's the benefits, the team composition. This is outlined in page 8 of 9 of Behavioral Health Information Notice 23-025. And this goes here. This is just an overview of what it is, but it could be MFTs, nurses, LCSWs, vocational. All the lists are here. Psychologists, physicians, so the LPHA is defined by it. Other types of providers, and here's a really big push, is that we know there's a shortage, is that there's peer support specialists, EMTs, community health workers as defined in the community health work services. So paramedics, other types of the peer support specialist piece is a strong component to this, and really something that is a best practice throughout this, is recognized best practice, and something we're encouraging because of their unique perspective, their lived experience, and their ability to really join in with that individual in crisis. So there's just a brief overview of that. And then we're going to open it up to any additional questions that you may have right now. I'm going to stop sharing.
Thanks, David. And I just wanted to hand it to Josh for just a few minutes. I know, Josh, you were going to kind of speak a little bit to the tribal relationships piece, and I just wanted everyone to be able to hear from you today.
Thanks, Josh.
Yeah, I appreciate that. I know this is a lot of information to take in, especially considering some of this is new. So my role, what I'm happy to do, is support those discussions and the connectedness between county governments, mobile crisis teams, behavioral health departments, and tribes and tribal serving organizations. And so that has been done through a variety of ways, but really it's just requesting TA as normally, and just identifying that would be helpful for you. And then we connect with you and we figure it out along the way. I'm not going to give directives necessarily, but I have been doing this for a while. And we also have Holly Echohawk, who's amazing in the field of native behavioral health. So we're happy to help. Thanks.
Thank you so much, Josh. All right. We are open for questions. Feel free to unmute yourself, put a hand emoji up, put your question in the chat. We're here to answer the questions as best as we can. I know that this is new, and the implementation plans are due on April 30th, with the implementation date being June 30th. And so it feels like we have time, but it will go quickly, as we've learned. I don't see any hands up right now or any questions in the chat. I can kind of reference a few questions that have come up just from our experience going through the first round with the first 48 counties that were required to do so. And actually, I see Dolores raised your hand. So go ahead, Dolores.
So I'm from Modoc County Behavioral Health, and we have an after hours number that rolls over from our main business phone number. So does our front facing number, can that be the same as our current number, or does it have to be completely different when you say front facing number for mobile crisis?
No, your front facing number for mobile crisis can be your access line as long as it's 24/7, 365 and is answered by a live person. It cannot be answered through an answering machine. It must be answered by a live person 24/7, 365, and that whoever answers the phone must be able to either pass the line to your mobile crisis team, who would then triage the call and dispatch, or triage and dispatch the call directly.
Great, thank you. And we don't have, that's what we have. We have a live person that answers after hours, and they do have access to our crisis response team.
Awesome.
The follow-up question I have with that was with the dispatch tool. So our after hours is contracted through another entity that then, like I said, transfers to our crisis team. Does our after hours need to have access to the dispatch tool? Would they be the ones dispatching?
Well, that's dependent on your contract. If your contract with that provider is that they are taking the call, triaging and dispatching, then they do need to follow your standardized dispatch process and protocols that you have in place, and they must use whichever standardized tool your county adopts. So whether it's your own that you develop and is approved by the state, or if you use the state standardized tool.
Okay. Yeah, follow-up.
Well, so would that mean that that our after hours line would have access to that crisis assessment tool? Are they utilizing that as well, or is that just for our mobile crisis team?
The crisis assessment tool is actually utilized in the field by your providers who are actually completing the assessment out in the fields. So whoever is taking the call, triaging and dispatching would be using the standardized tool and also following your protocols.
Okay, thank you. As far as the utilizing the language line, how can you just give me maybe some examples of how other counties are doing that? Are they just using because we do have a contract with the language line? Is that what they're doing just for translation, while on the field? If there's not a person that speaks that language, is that how it's being implemented?
Yes. So if you have a team out in the field and they unfortunately don't speak the language of the person in crisis or the family in crisis, then they are utilizing the language line. Some counties have the ability to, provide a team member that speaks the language and assess who's the best fit for this response, which should be it's a best practice. But if you don't have someone, you could utilize the language line for translation.
Okay, thank you.
You're welcome. I see a question in the chat from Aaron Fisher. The slide deck will be posted on the website, and it will also be emailed out at some point to all of those of you who are here today who have participated. It does take a little bit of time to get on the website. It does have to go through a process of editing and remediation, so it won't be on there right away. And the recording will also be there as well. Dolores, did you have another question or just your? Yeah.
I was on mute and you must have heard me. I said I'd have another question. So the one question that I did have was around having the staff start the trainings. I know that you said there's 10 out of 29 that were required. Do you have an idea of how many hours those 10 trainings are in thinking of preparing the timeline of when we should start having staff do trainings?
Yes, some of them are quite lengthy. I believe a few of them are 3 to 4 hours, and a few of them are around 90 minutes to 2 hours. So it's quite a bit of time. So I would definitely encourage all of you to get your team members to start incorporating those trainings now as soon as possible.
This is Adriana from Mono County. I just wanted to let everyone know I calculated it's about 30 hours of training per person.
Thank you.
If that sounds right.
She said 30 hours.
I see Linda Kroner has their hand up.
Okay, so I was just wondering, the 30 hours of training is, I guess my question too is, when I came here to listen today, there were several other dates. Are those dates like the same thing you're covering today, or is that something totally different?
So this will be a series that will happen once a month at least. And the purpose of this is really to bring all of the counties that have the later adoption date of the benefit to be able to support you in one, completing your implementation plan and getting it submitted, and then actually implementing the benefit. And so we have the MTAC team, myself, David, Josh, we've all supported the 48 counties that went through the first round. So they were required to implement by just a few weeks ago, December 31st. And so we've learned a lot ourselves in that process. And so we're just trying to be as proactive as we can with you all, with the 12 remaining counties to kind of bring what we've learned through this process and what we know the state is looking for. There are some very specific things that they're looking for in the implementation plan. And that's why we revised it to be a little bit more user-friendly and to really be more concrete and absolute. And so these meetings are really not that providers aren't welcome, but they're really for that team that is going to be developing that implementation plan template, and really that maybe administrative team that is more responsible for the development of that template and the plan, as well as making sure that the teams are trained and all of that. And so anyone is welcome, but that is what the focus of these communities of practice will be.
Okay, and then when the woman spoke about the 30 hours, is that the 30 hours? Is that what with the 10 core trainings? Is that what added up to be 30 hours?
Yeah. So
Yes.
there are 10 required trainings. 5 of them, it's confusing because they're 5 are labeled core and 5 are labeled enhanced. But overall, there are 10 required. The core and the enhanced are required. And so it's approximately 30 hours of training.
Okay. Thank you so much.
Mm-hmm. And thank you, Adriana, for doing that quick calculation.
Is more of a panic calculation to see when I should have my team do it.
Yeah, thank you. All right. Well, I think that's a wrap. Thank you all. If you're still here, thank you. We're going to go ahead and close the session if there are no additional questions. Again, feel free to reach out if something comes up later. We are here and we're available. Our focus will be you all 12 counties that have your implementation date on June 30th. So you are our main priority these next 6 months. So you will hear from us as well.